to 10.
We're joined tonight by Dr. Celeste Reese-Willis, who is a telehealth doctor who is probably staying pretty busy right now during COVID-19. Doctor, tell us first of all how your practice is doing during a time like this. A lot of people are relying on telehealth. How important is it during a pandemic?
Well, telemedicine is actually shown to be something that is really a big factor in helping to mitigate or decrease the risk of spread of COVID-19. A lot of patients are leaning on telehealth to meet a lot of their medical needs, which is very good because we want to decrease the contact between patients and other individuals, especially because we have a viral pathogen out there that is spreading prior to a patient exhibiting symptoms.
You mentioned this to me off air. A lot of people feel trapped in what they can't do, can't leave the house, can't go to work,
Yes.
can't things like that. What can they do to stay healthy right now?
Okay. One of the things I encourage people to try to focus on is making sure that you actually follow those basic steps we've talked about in cleaning and disinfecting. Some of those forgotten spots that we may forget about. Most of the time people will remember tabletops or countertops. A lot of times they'll remember door handles, but sometimes people don't think about their headphones, like AirPods or Beats that they may use when they may go to the grocery store. I know that most people are quarantined, hopefully at home, practicing social distancing, but while you're out, a lot of times you'll touch your AirPods and touch other things, and that is a form at which the virus can pass. So remembering that, remembering to clean your remote controls, various door handles, the bathroom door handles, the inside and outside door handles, kitchen sink handles, as well as the coffee maker.
A good reminder. I'm seeing more on social media, Twitter threads and Facebook posts from people in their 20s trying to tell other 20-somethings, hey, I had this and it was the worst 3 weeks of my life. What would you say to people who don't feel susceptible, although they probably are?
Well, I would just basically point them at the science and the pattern of this virus. As we've seen, it started in China, first diagnosed on January the 7th, and so we've been able to follow it over the last several weeks, and we've seen it just implode, especially in nations like what's going on in Italy, and we are just a couple of weeks behind Italy. So what I would encourage them to do is to utilize all of their resources, their smartphones, etc., to take a look at some of that information, because I think it would do a lot to help shed a lot of light on why it is that we must take these precautions very seriously and why social distancing at this time is so important.
And that doesn't mean going to your friend's house to hang out during this, does it?
Right, exactly.
Very serious stuff. Dr. Celeste Reese-Willis spending some time with us on a Sunday. Good advice, Doctor. Thank you for your time.
You're so welcome. Bye-bye.